The ABCD study is tracking almost 12,000 children, 9 and 10 years of age. When we initially recruited them, they were 9 or 10 years of age. And we're tracking them for at least a decade at 21 national university sites across the nation, where we have turned all the dials on our machinery, for example, on our MRI scanners, to make them all work in exactly the same way. And then at those 21 sites that were very carefully chosen to be able to sample the population to be 100, as close to 100% representative of the population of the US. So we have these nearly 12,000 children in the study, and we're now entering the 5th year. And as part of the study, we've been collecting all kinds of data about them, from neurocognitive status to imaging. We image their brains so we can understand brain health. We have their genetics. We have their life stressors, how many times they knock their head in a game of football, how much time they spend on the screen or playing video games. You name it, we have it. Their diet, the air they breathe.
Why did you start with kids who are 9 years old?
So 9 was chosen as a very specific age because a lot happens to youngsters. 9 years of age, these are healthy young children. And if you think about what happens between 9 and 19, those are the critical years, through puberty. And what we're interested in is some of those youngsters will go on to be geniuses, and they'll be incredibly successful. And we really want to know what makes a youngster successful. And of course, unfortunately, some of those youngsters will go on to develop disorders and diseases. By definition, unfortunately, someplace between 0.5% and 1% of them will develop a psychotic disorder. And if you think about those critical years between 9 and 19, that's when we would see schizophrenia emerging, bipolar disease emerging. And actually the major motivator for this study, because the study was primarily comes out of the National Institute for Drug Abuse, is to try to understand things that lead to addiction in youngsters. So that's a key piece of the project. We're talking about Alzheimer's disease, and you're talking about something that's going to develop 30, 40 years later into symptomatology, but the groundwork's being laid very early in life.